One is the facet joints. Now, facet joints of the lumbar spine, they have kind of a unique orientation. If you can see here, the facet joint of the lower lumbar area or the L5S1 is coronal in alignment. So you can see that it is in the more in the coronal plane of the human body. Whereas as you start going up, the orientation of these facets becomes more and more sagittal. So if you go up in the upper lumbar spine, the orientation of the facet joint starts becoming more and more sagittal. So it is in the thoracolumbar area, this orientation is sagittal. Then again it starts becoming coronal as you go into the thoracic spine. But notice the difference between the inclination of this facet joint and this facet joint. It is more coronally aligned. Now this has some consequences. The consequence of this unique orientation of the superior facet is that the superior facets, because they are aligned this way, first of all, do not allow much of rotations to happen in the thorax, in the lumbar spine. You see that the center of rotation of this facet joint falls behind the vertebral bodies. That's why very little rotation happens in the lumbar spine. And because they are coronally oriented, it is very important for it to not prevent a forward slippage of the vertebral bodies. So if they are coronally plane, then it prevents the L5 from moving in front of the sacrum. You can imagine that. But if the for some reason, if this particular facet joint, the uh, superior facet of S1 and the inferior facet of L5 is more in the sagittal plane, then it will allow more motion in flexion and extension. And that is one of the reasons for spinal instability. So something like that is called as facet tropism. If your facet joints are more sagittally oriented, it will allow more motion. But if they are coronally alignment, then they will allow less motion in the anterior posterior direction.